Nicotine gum. By completion of this activity, participants will be able to describe the properties of the gum, list its advantages and drawbacks, describe availability and coverage for the gum in the United States, explain standard dosing recommendations, describe appropriate gum use, and list common side effects and treatment or prevention strategies. Nicotine gum is one of the most commonly used short-acting forms of nicotine replacement therapy. The way it works is that the gum releases nicotine, and that nicotine is absorbed by the oral mucosa, or the inside of the mouth, the inside of the cheek. It takes nicotine gum about 20 minutes to reach peak plasma levels. That's compared to the patch, which takes up to 3 hours. It's available in several flavors, and most users find these options favorable to the original gum. Key advantage is that the nicotine gum can be used as needed, like other short-acting forms of nicotine replacement therapy. And unlike the medications or the patch, where you're not able to adjust the dose or able to tailor the use to your cravings. Drawbacks include that it requires repeated use throughout the day, and that leads to more variable nicotine levels. And it also requires more instruction for correct use. It's not just swallowing a pill or putting a patch on your skin. The nicotine gum is available over the counter in the United States, and if you price it on Amazon.com, it's about 15 cents per piece for the generic. The name brand options run about 35 cents at the lowest cost I could find per piece. Coverage. The Affordable Care Act requires that all Medicaid programs cover all tobacco cessation medications beginning on January 1st, 2014. And gum coverage is covered in all 50 states and the District of Columbia, with some caveats. Only pregnant women are covered in South Dakota, and coverage may vary by health plan in the District of Columbia and the states listed. The way the gum is dosed is that smokers are instructed to use it about every 1 to 2 hours for 6 weeks, and then gradually reduce over a second 6 weeks, perhaps for 3 weeks every 2 to 4 hours, and then for another 3 weeks every 4 to 8 hours, for a total duration of 3 months. The recommended dose is 4 milligrams for smokers who smoke at least 25 or more cigarettes per day, and 2 milligrams for those who smoke less than 25 cigarettes per day. The appropriate use of the gum is to chew it whenever a person has the urge to smoke. But what's been found is that this generally will lead a person to underuse the product. An alternative approach is to recommend that the smoker use the product every hour while awake and use it as needed in addition to every hour. Acidic beverages such as coffee and soda should be avoided before and during gum use. These acidic beverages will make the saliva increasingly acidic, and that will reduce the absorption of nicotine into the bloodstream. The chew and park method is how the appropriate use of the nicotine gum is described. You chew the gum until the taste disappears, maybe 3 or 4 chews to break it up a little bit, and then you park it in the buccal mucosa. This just means between the gum and the cheek. And then you wait until the taste disappears, maybe a minute, and then you chew it a few more times to release more nicotine. repeating that cycle for 30 minutes, then discarding the gum. So if the person is discarding the gum in less than 30 minutes, or it's running out of its taste in less than 30 minutes, it could be an indication that they're chewing it too much and they're not letting it sit and be absorbed. This kind of method, the chew and park method, is important for optimal results. If the gum is chewed too rapidly, then the nicotine will be released faster than it can be absorbed by the gums, by the cheek. And what happens is that the nicotine is swallowed. When it's swallowed, it's absorbed into, it passes through the liver, and the liver will degrade it, so it becomes mostly ineffective. Side effects and prevention strategies. The side effects of the gum are actually mostly due to the inappropriate use of it. So chewing it too fast, swallowing it, and the associated effects of that. So the associated effects can include stomach or throat irritation, nausea, vomiting, stomach pain, constipation, hiccups, headache, excess salivation, a sore jaw. The prevention strategies are just to reinforce that chew and park method. Some more side effects are mouth irritation or ulcers. If this occurs, it's probably not due to inappropriate gum use, and it might be a good idea. A reasonable alternative would be to recommend another form of a short-acting nicotine replacement, like the lozenge or the inhaler. In people with TMJ or temporal mandibular joint disease, just that chewing action can cause pain. And people with dental appliances or poor dentition can have the gum stick to their dental work and actually even damage their dental work. So for these individuals, you could consider recommending an alternative form of the short-acting nicotine, such as the lozenge or the inhaler.